I'm just finished putting on my hand sanitizer. And hello, my name is Liz. I'm going to be your SPTA for today. Can I just confirm your name and date of birth?
Brandon Johnson, 51004.
Okay, perfect. So I see that I have the correct patient. So what we're going to be working on today is going to be assessing your range of motion for your cervical extension. So that just means seeing how uh, easily it is for you to move your head back as far as you can. And then I will also be assessing your trunk extension. So just seeing how easy it is for you to lift up your back from the table, or essentially just to get up, since these are movements that we use every day. So for looking up, looking at the TV, something like that. And then for trunk extension, getting up from a chair, getting up from bed, it is very critical to have these uh, parameters set in order for us to continue with our activities of daily living. And then before I get started, I'm going to mention that I will be in physical contact with you, and I want to make sure that I have consent to work with you today. Is that all right?
Yes.
Perfect. And then I also see that you have shoes, which is very important as we will be getting up and exercising today a little bit. So that is very essential. So now I'm going to go ahead and get started. And I'm going to be testing the range of your cervical extension. So I will be using the help of a goniometer to get that measurement for you. Um, and first, I'm going to assess your range of motion manually. So I'm going to be looking for your C7 and T1. So I see your T1 right here and C7. And then I'm going to assist you extending your head back. So go ahead and extend that head back as much as you can. Perfect. You could stop and then relax, go back. Perfect. Now I want you to go ahead and repeat that one more time for me on your own. All right. And relax. Can you do that one more time for me? All right, right there, you can stop. Perfect. All right, and go ahead and relax one more time. I'm going to go ahead and grab my goniometer, and my axis is going to go on your auditory meatus, and then my moving arm is going to line up. Oh, my stationary arm is also perpendicular to the floor, and my moving arm is going to be lining up with the bottom of your nose or the base of your nares. So we're gonna line that up right there. Perfect. All right. And now I'm gonna go ahead and palpate again for your T1 and C7. All right. And now I want you to go ahead and extend your head back. All right. And stop right there. Perfect. All right. Perfect. All right. So it looks like we got a range of about 25. All right. So it looks like we have a range of about from 0 to 25. The normal range for cervical extension is 0 to 45. So that means you just might have a little bit of tightness and restriction when pulling your head back. So that is what we're going to be working on today. So the first thing that I'm going to have you do is I'm going to assist you. What you're going to do is just push your head back as far as you can go, and I'm going to push you into a little bit more. So just trying to get into that full range, all right? And I'm going to help you with this. While I'm doing this, you should not feel any pain or discomfort. If you do feel any excruciating pain or pain anywhere else that we're not in the area in, let me know and we can modify and adjust and work around that, all right?
Okay.
All right. And for this, we're going to be doing 2 sets of 8, all right?
Okay.
All right. So just go ahead and extend your head back as far back as you could go. And I'm going to assist, pushing you back a little bit more. Perfect. And then we could go back. 1, 2, perfect. 3, perfect. 4, And how are you feeling?
Good. I feel okay.
Any pain, any discomfort?
No.
All right. 6. Perfect. 7. And 8. Perfect. We can go ahead and relax and take a break, and then we'll continue the other set. So how did that feel?
Feels okay.
Feel good? Do you feel any pain when I'm pushing you into that full range into the back?
No pain,
No?
just a little tired.
All right. Perfect. Let's continue again and finish the last set. Feel good? Go ahead and extend back. Perfect. 2, 3. Still no pain, no discomfort.
No pain.
All right. 4, 5, 6, 7. One more. 8. All right, perfect. You did a great job.
Thank
So, how did that feel? A little bit easy, a little bit hard?
Yeah.
Feel like you were able to do it?
Yeah, it feels good.
All right.
Just a little tired.
A little bit tired. All right. So that is potentially what you will be feeling. Is that I know you have a little bit of tightness and you might have some restriction while we're working on those muscles and extending your head back. So what I'm gonna give you is a progression and a regression for that. So regression for that would be doing the same thing, just less of extending all the way back, so not going far as back. And then a progression for this would just be you trying it to do on yourself, which I saw you did do it pretty well at the beginning. So that was very good. And that would just be a way for you to progress and start working on those neck muscles a little bit more. And overall, you did very good. So I'm going to go ahead and jump into your trunk extension manual muscle test. So for that, I'm going to have you lay onto the table and lay on your stomach.
Okay.
Okay, perfect. And then I want you to have your hands on the side, perfect, as you already do. I'm going to stabilize on the back of your legs. And then what I want you to do is just go ahead and lift your chest up, and I'm going to palpate right here on your back, all right? So go ahead and lift your chest off the table. Perfect. You can go ahead and relax back down. So I felt a very good contraction of those muscles in your back, the erector spinae muscles, and I felt a very good contraction. So that means your muscles are actively working. So now I'm going to go ahead and continue with the manual muscle test. So what I'm going to have you do is place your hands behind your head. Perfect. And then what you're going to do is I'm going to lift your chest from up the table. Try to get as much as your chest up from the table. So from about right here up is what you want off the table. And I'm still going to stabilize at your legs, all right?
Okay.
And it's just going to be a quick up and back down, all right?
Okay.
Perfect. All right. And then go ahead and go up. Perfect. And back down. All right, perfect. You can relax. So I see that you fully got your chest off of the table, which is very good. That is exactly what we want. That means all those muscles in your back are properly working and they're doing the right things. All right.
Mm-hmm.
So now just to go ahead and strengthen those muscles a little bit more, I'm going to give you a exercise for you to do just to strengthen these muscles a little more and just to strengthen more. All right. So what I'm going to have you do is the same hand placement as you had when we did the test.
Okay.
So hands are going to be on your head, and then we're just going to be repeating up and back down, the same thing, and we're just going to do these for 2 sets of 8 as well. All right.
Okay.
And then go ahead and try 1. Perfect. 1.
Sorry, my legs are coming up a little bit. Is that normal?
Just try to keep them down. You could hold onto the table a bit with your feet, but essentially they will be coming up a little bit as it is hard for your back to only be bringing up yourself.
Okay.
So, yeah.
Ready?
Yes.
Okay.
Go ahead and continue. Perfect. 3, 4, 5. And how are you feeling?
Tired.
All right. 6, 7, 8. All right, perfect. You can go ahead and relax. So I know that was a little bit tough and you might feel all those muscles working. Did you feel any pain at all or discomfort while doing this?
No, just tired.
Just tired. Yeah, I know it might be a little tough to be able to get
Yeah.
these exercises down. It's a new exercise and I know it might be a little hard. All right.
Mm.
So I want you to do one more set of that. So one more set of 8, and then I will continue on and give you a progression and regression for this exercise if it might be a little too hard or a little too easy.
Okay.
All right. I'm just going to go ahead and watch your form again.
Ready?
Yes.
Okay.
And start. 1, perfect. 2, 3, perfect. 4, perfect. 5, perfect. 6, perfect. 7, and 8. Perfect. You can go ahead and sit up for me. So after that last set, how did you feel? I know you said you were feeling a little bit tired. Yeah, I know these are some new exercises, so it might be a little hard to get the hang of it. But with overtime, it should get a little easier. So regression for this exercise, instead of having your hands at your head, we would put them behind your back. And what this will essentially do is just help you get more of a push off the table and less of that weight from your hands. And then progression for this would just extend, instead of having your hands at your head, we would have them extended out. So that might be a little harder as it creates a longer lever arm for you. So it would be a little bit harder.
Okay.
All right. And then I'm just going to go ahead and wrap up what we did today. So today what we did is we assessed your range of motion for your cervical extension. So seeing how far back your head can go. And what we got was a range of 0 to 25, which is a little bit of a restriction since the normal range is 0 to 45.
Okay.
And what we did to work with that today is we did some cervical extension exercises while I actively assisted you to get into that full range. And overall, you did very good with that, and you did a very good job. And then I also assessed your trunk extension strength, so just testing the strength of those muscles in your back. And overall, you had a grade 5, which means you were able to fully lift your chest off the table and without any issues, so that was very good. And then what we went to do ahead with that is go ahead and strengthen those back muscles a little bit more, just to be able to keep that strength in the back that you have. And then overall, you did very good. I know you mentioned you were a little tired, but that is what we will be feeling with some exercise and some movement. All right.
Okay.
But overall, you did very good. I'm going to go ahead and wrap up. And your next session, let me know how you're feeling after this session, and then we will continue on from there. All right.
Okay.
Thank you. It was a pleasure working with you.
You too.
Perfect.